Scano, Sago, hello everyone. Lori Davis Hill here, Director of Health Services and Incident Command for Six Nations of the Grand River Pandemic Response. Let's get us a little closer to the weekend and move on over to our wellness area with your May 29th Six Nations COVID-19 update. Now, in one of our prior podcasts, I mentioned that May is Speech and Hearing Month. So today on the podcast, it is my pleasure to welcome in representatives of our Six Nations Speech Services team. Please welcome Jordanne Golden, speech language pathologist, and Katharine Hayhoe, communicative disorders assistant. Hi, ladies. Can you each tell us a bit about your roles here at Six Nations Health Services?
Sure. So my name is Jordanne. I'm a speech language pathologist with therapy services. I see clients throughout the lifespan who have communication difficulties. So, for example, children who have trouble saying their sounds, adults who may have had a stroke and have difficulty finding the words for what they want to say. And another area of practice that I'm in is swallowing disorders. So I recommend diet modifications and safe swallowing strategies for individuals who may have neurological disorders, brain injury, or a history of stroke, and they have difficulty swallowing their food.
And my name is Katharine. I'm a communicative disorders assistant, and I work under the supervision of Jordanne, speech language pathologist. I also see clients here in the community across the lifespan. I spend a lot of times in schools, in the preschools, at community living, and then in community members' homes seeing clients. I work also on speech sounds, social skills, and helping people speak fluently.
Thanks for the introductions. Can you let us know what made you each pursue a career in this field?
Sure. So back when I was 21, my mother had a hemorrhagic stroke, which left her nonverbal for a period of time. And I watched her recover with the help of an excellent team of therapists, which included the speech therapist. And I was really amazed at what the speech therapist does. And because I've always loved language, it just seemed like a natural fit.
For me, I wanted to become a CDA because I loved working with people and I loved working with kids. I also see how important the role of communication is in our day-to-day lives, and I really want to help people achieve that. Like Jordanne, I also had a friend who had a traumatic brain injury, and I just saw how much the therapist helped the family learn to re-communicate with their loved one.
Communication certainly is important in everybody's lives. Can you share what speech and hearing awareness in this community means to you? Katharine?
Yeah, sure. I think it's super important to continue supporting our clients and the students who need it while the schools are out. I think that communication is one of the biggest ways that we communicate with our loved ones, and keeping those lines open are very, very important. And keeping those lines open in, be it traumatic brain injuries, if it's developmental, so little kids that are learning to speak who might be having some difficulties, all of those situations are really important to help people around us.
And Jordanne?
Yeah, so for me, it just means that people kind of understand that not everyone communicates in the same way, and they have a willing attitude in the community to just adjust their communication to meet the needs of the person they're communicating with. So, for example, if you're communicating with a person who has a hearing loss, being aware of speaking clearly, using gestures, sort of being face-to-face with that person, that's one example of awareness in action. So,
Go ahead.
Sorry, I was just saying, just acknowledging that communication is kind of a two-way street.
It sure is. It's almost like playing a game of catch. I can imagine that seeing people with masks on is a bit of a challenge for those who might be avid lip readers. So, it's always about finding new ways of doing things. Do you have any recommendations for that?
Sure. I think if you're, a person who's hard of hearing and the mask is a challenge, encouraging people to write. If you're really struggling, writing some of those key words. It's a bit challenging with physical distancing as well, because normally I'd say kind of move closer, but that's not always possible in these times. So I would say writing and gestures and just speaking clearly and loudly would be some strategies I would recommend for that, for sure.
Thanks a lot. I really appreciate you two joining us today. Having worked as a speech language pathologist with therapy services myself, prior to becoming Director of Health, May as Speech and Hearing Month is certainly near and dear to my heart. And let me say that our community certainly relies on us as speech language pathologists. And I just again want to thank you for sharing a bit about the world of speech and hearing. So happy May as Speech and Hearing Month to you both.
Thank you so much. You can check out our Healthy 6 May Facebook page. We're going to post a fun video about celebrating May month as well.
I'm sure everyone looks forward to that. So
Yeah.
Let's move on now to our Friday numbers. Today in Ontario, the province is announcing 27,210 overall cases, with 344 new positive cases yesterday. Here at Six Nations for Friday, May 29th, our case count stands at a total of 14 cases of COVID-19. Breaking things down, we now have 3 active cases. 10 cases are now considered resolved, and to date, we've reported 1 death. Our testing on this day's tally is 728 total tests. 652 of those tests have been given negative results. 105 people have been directed into self-isolation by order of Oswego Public Health. Looking at our neighbors, Mississaugas of the Credit remain at 1 positive case reported. Haldimand Norfolk Public Health Unit is reporting 217 positive cases. 136 of those have recovered and 31 deaths. Grant Public Health Unit is reporting 108 positive cases, 94 resolved and 4 deaths. Hamilton Public Health Unit reports 664 cases, 444 are resolved and 35 deaths. And the Toronto Public Health Unit reports 10,726 positive cases, 7,944 are resolved and 800 deaths. Testing is now available to everyone. If you want a test, let's start off by simply calling the Six Nations COVID-19 Assessment Center. This is the procedure that you have to follow. You have to schedule an appointment, and the COVID-19 hotline is open 7 days a week to take your calls. We're asking people to get tested even if you have the mildest or simplest of symptoms. The Six Nations COVID-19 Assessment Center can be reached at 226-446-9909 or toll free at 1-855-977-7737. Plain and simple, early detection allows us to stop the spread. I just wanted to explain what happens when public health conducts contact tracing. There are 2 parts to this process. First of all, they will look at the time period of 2 weeks or 14 days before your symptoms started. The nurse will review your activities, common places that you have visited, for example, grocery stores, takeout food establishments, or gas stations, etc. New places you may have visited, such as garden centers, and the people that you have been in contact with. They do this to try and find out where you might have come in contact with the virus. Secondly, they also look at the time period of 48 hours or 2 days before your symptoms started, up to the date that you speak with the nurse. The nurse will ask you to recall all of the people that you have been in close contact with. And by close contact, we mean those that live in your household, those you work with, those people that you may have provided care to, those that you may have spent time with in an enclosed area, such as a car. They will also look at non-close contacts, which may be people that you have been able to social distance from, but have not worn a mask. These are all the people that the nurses will notify as contacts, who will need to self-isolate for 14 days, who need to be tested if they too become symptomatic, or in the case of a non-close contact, they will need to self-monitor for symptoms for 14 days. A good practice for everyone is to keep track of where you have been and who you have come into contact with. Save your receipts or put your daily travels in your phone. This will help you to recall these things when you're asked. Let's all work together to keep Six Nations COVID clear. Wear a mask in public, keep physical distancing, wash your hands frequently, and clean high-touch areas often. I will wear a mask to protect you, while you wear a mask to protect me and your other family members. It is Paramedic Services Week. Listen to our weekend podcast for more important tips and information for our paramedic services about keeping you safe during this COVID-19 pandemic. And until tomorrow, a few announcements. Ganeo's Health Center COVID-19 operations are this. Please use the front door only. You can only access services with an appointment. To reach the Oswego Medical Clinic or the Oswego Lab, call 519-445-2251. And for Oswego Public Health Office, call 519-445-2672. When you have booked an appointment, you will be authorized entrance to the building, and you will go through an active screening process to identify symptoms. If you do not have an appointment, you will not be given access to the building. Again, the numbers are 519-445-2251 to reach the Oswego Medical Clinic or Lab, and 519-445-2672 to reach Oswego Public Health. Public Works continues to request donations of homemade masks, and for more information, you can call 519-445-4242. And for those of you who need support, you can connect with the Six Nations Mobile Crisis Service by phone at 866-445-2204 or 519-445-2204, and that's available 24/7. You can reach them by text Monday to Friday, 8:30 to 4 at 226-777-9480, or by live chat Monday to Friday, 8:30 to 4, and the link is found on the Six Nations COVID-19.ca website. Remember to keep our frontline workers here on Six Nations and around the world in your thoughts and prayers. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Nyawa.